All right. Welcome, everyone, to Plant-Based Kidney Health. As always, I'm Dr. Sean Hashmi. My partner is Michele Crosmer. Today's question that we received from you guys was, what about people who have CKD? Should they really be supplementing with vitamin D? And if they should, what dose should they be taking? So what do you think, Michele?
Yeah, so a little background first, vitamin D, it's one of our fat-soluble vitamins. There's different functions and roles that vitamin D plays. We commonly think of vitamin D promoting calcium absorption, bone health, but there's also immune functions of vitamin D as well. And we get vitamin D, from sunlight. Our body is able to turn that into vitamin D. There's some food sources, fatty fish, egg yolks, liver, and then supplements as well. And the thing that's important to remember with vitamin D is that it is a common deficiency amongst the general population, a lot more common than we used to think. It's something that's been added to, if you look at your food label, that vitamin D is now a nutrient that's listed that used to not be listed because more people are deficient in vitamin D. And then people with kidney disease are actually more likely to be deficient in vitamin D or have low levels. And part of the reason for that is the kidneys play a role in turning vitamin D into its active form that the body can use. So those are all important things to think about with vitamin D. And of course, we could say, hey, just go get more sunlight. But a lot of people, they work inside these days. They, don't want skin cancer, so they're using more protection. And sometimes, depending on where you live, that's not even enough. So supplements always come up. I think one of the important things to think about when we think of supplements is both the endocrine and the autocrine functions of vitamin D, because oftentimes we just think of those endocrine functions of the calcium, phosphorus, homeostasis. A lot of times the active form of vitamin D will be prescribed for people with kidney disease to help lower their PTH levels. And so that's our hectorol or calcitriol that you often hear of. But that active form of vitamin D does not target the immune function and immune benefits of vitamin D, which is where, on the autocrine side. And so that's something where the supplemental form or dietary form or supplemental form of vitamin D would be important. And so when we look at that, and then we're looking at supplements, there's D2, D3. Generally, D3 supplementation, has been found to raise vitamin D blood levels a little bit better. So usually you'll see D3, prescribed as or used as a supplement. But main thing with supplements, I think first thing is you always want to know, even though it's a very common deficiency and it's not super likely, to be at these toxic levels, it's still a fat soluble vitamin. You want to know what the proper dose is that you should be taking, because there's very high doses of vitamin D, and then there's also lower doses or more maintenance type of doses. So if you have your blood levels checked, then if you have normal, if you have insufficient levels, or if you're deficient, and then a dose can be, properly dosed from there. So when we're looking at that, usually about 1,000 to 2,000 IUs or international units is a pretty standard dose. That's what you oftentimes find in just over-the-counter vitamin D supplements. That could be up to about 4,000 to 5,000 IUs. And that's something that'd be taken daily. That 4,000 to 5,000 is a higher dose. And that might be needed for someone who has insufficient levels. But the thing is, if someone's deficient, oftentimes you'll see the physician prescribe 50,000 IUs, and that might be on a weekly basis or every other week. But usually that's not something that's taken long term in that higher amount. It's to bring your blood levels up to a normal level. And then, maybe you go down to 1,000 or 2,000 IUs daily. The other thing with supplements is, again, there's tablet form, there's liquid form. Just in my opinion, I feel like the liquid, drops or liquid forms of it, you're able to adjust the dose and kind of titrate a little bit more easily, because you can change how many, droplets that you have. And so if you need a little bit more because your doctor, your dietitian's told you that, or you need a little less, then you can adjust that that way. The other thing with vitamin D, and you guys should check out our episode on vitamin K2, is you'll see now it's more common to have vitamin D3 and K2 together in a supplement form. And that's, so listen to that episode, but that's something that might be beneficial as well. If you are taking vitamin D supplement and you have kidney disease, then considering taking it with K2 so that it is helping with where that calcium is deposited in the body. So those are all things to consider with that. I'd say overall, it's likely that if you have kidney disease, you might have lower levels than normal, might need to be supplementing. And then again, we think of on the immune and anti-inflammatory side of things, potential benefits of the vitamin D supplementation, but you really do want to know where you're starting so you know how much to dose that. And then make sure too, especially if you're being prescribed a very high dose vitamin D, that you don't, you check it and then, 3-6 months down the line that you're checking it again, because you want to see how your levels have changed. And I've met with clients before that they had it checked a year or two ago, and they've been taking this very high dose or very low dose, and their numbers have changed a lot, their blood levels, and it just wasn't checked. So that's something that I would say you don't need to check it every month by any means. But if you are adjusting your dose of your supplement, then 3 to 6 months out, you'd want to check your blood levels again to make sure that you are taking a proper dose. And then the other thing too, when you're looking at your blood levels to keep in mind as far as the supplementing is that, 30, or higher is typically in that, okay, they're saying you have a normal vitamin D level, but some people can hover right around that 30 mark, maybe drop a little lower, be a little higher. And that can still depend, doesn't mean, oh, you don't need a supplement. You might still need a supplement to keep you in that normal range, or people with autoimmune kidney disease might even need to be using that supplement to get to a more optimal level, 50, 60 for your blood level for vitamin D. So typically it's something that is a safe supplement that we oftentimes use in people with kidney disease and the general population, all sorts of different doses, but that's what you would want to be thinking about. And if you guys have more questions on that, please put that in the comments.